my name is Brian Kim. I'm professor of dermatology at Icahn School of Medicine at Mount Sinai. I'm also vice chair of research. Yeah, well, the main topic of my address talk is really about what has happened in the last 10 years with regard to itch. A symptom that was largely overlooked in dermatology, was not really considered a disease. And there are many, many diseases that fall under the umbrella of itch. And we have been able to advance through science, new understanding of the biology, the mechanisms of these diseases, and to advance through translational medicine and clinical trials, new therapeutics towards these conditions that in turn validate the existence and importance of these conditions, and also create regulatory pathways that actually make these conditions go from the question of, is this a disease, to yes, it is a disease, to is there a way we can find a way to actually get a drug approved? Yes, if we do, now we have a new drug, and then that validates the entire enterprise. And that's really the thrust and theme of my talk. Yeah, so we are very interested in itch still. We're interested in other mechanisms of itch that encompass diseases that we still have not conquered. These would include neuropathic itch conditions such as brachioradial pruritus, notalgia paresthetica, scalp pruritus, but there are many other conditions as well. But also we have extended to understanding not just itch and sensation, and even pain in some ways is another area that we're interested in, but not the traditional sense of pain, not like low back pain, but different kinds of pain that affects patients with, for example, chronic hand eczema. And additionally, irritation. What is irritation? We often view irritation as a non-scientific term, but we now know that there's a lot of science behind what causes not just pain or itch, but also irritation. And lastly, we believe that sensation is more than just a subjective experience, but sensation itself, neurologically, shapes the scope and intensity of inflammation in the tissue. And this is why we believe things like stress, but also itch and pain itself are actually in of themselves pro-inflammatory states. They're not just sensations. Yeah, we give a nice little poster. We were very instrumental early on in targeting or deploying with the companies Regeneron and Sanofi to really target their agent dupilumab towards prurigo nodularis. And that's one great example of a disease that was, quite frankly, questioned as whether it was even a disease. And then we went to clinical trials with dupilumab, and that led to the first FDA-approved treatment for prurigo nodularis. Well, this poster was really highlighting, we know that many patients with prurigo nodularis can vary in terms of how quickly they respond to dupilumab. And the question is, if they do respond to dupilumab in early, medium range, or late, does that affect the durability of their response? And so far the answer seems to be no. So whether you respond right away or in delayed fashion, you will have a really good response to dupilumab if you have prurigo nodularis. And that was really the main focus of that poster.